objectives for today's topic are that at the end of the lecture, the students should be able to describe the boundaries, contents, and relationship of the cubital fossa, identify the surface anatomy of cubital fossa, discuss the clinical importance of the cubital fossa, and the student should be able to describe the formation of anastomosis around the elbow joint. So, Bismillahirrahmanirrahim. Cubital fossa is a triangular depression that lies in front of the elbow joint. When the elbow joint is extended, a triangular depressed area can be observed. This triangular area is called as cuboidal fossa. The cubital fossa is an important transition area through which the nerves and the vessels enter into the forearm from the arm. Now we will discuss the boundaries of cubital fossa. As we said, it is a triangular depressed area. It has mainly three boundaries: a superior boundary, medial wall, and a lateral wall. Superiorly, it is bounded by an imaginary line which connects the medial and the lateral epicondyle of the humerus. Medially, it is bounded by the pronator teres muscle. Now in this figure, the pronator teres muscle is dissected to show the neurovasculature present in the cubital fossa. The lateral wall of the cubital fossa is formed by another muscle which is called as brachioradialis muscle. The brachioradialis muscle and the pronator teres muscle, they are the muscles of the anterior compartment of the forearm. So, the triangular cubital fossa is bounded superiorly by an imaginary line passing between the two condyles, the two epicondyles, medial and the lateral epicondyles of the humerus. Medially, it is bounded by pronator teres and laterally it is bounded by brachioradialis. In this figure, you can clearly see the boundaries of the cubital fossa. So you can see when the elbow is extended, a triangular depressed area is present. This triangular area is called as cubital fossa. The superior border is formed by imaginary line passing between the medial and lateral epicondyles of the humerus. Its lateral border is formed by the brachioradialis muscle. Now you can see the figure that brachioradialis muscle has a medial border and a lateral border. So the medial border of the brachioradialis is actually forming the lateral border of cubital fossa. The medial border of the cubital fossa is formed by the pronator teres muscle. Now again you have to look clearly into the figure. The pronator teres muscle has two borders, a lateral border and a medial border. The lateral border of the pronator teres muscle is forming the medial border of the cubital fossa. Now in the BCQs, we can ask you the boundaries of cubital fossa. We can put a question that which of the following muscle forms the lateral border of the cubital fossa? Your answer should be brachioradialis. Which of the following muscles form the medial border of the cuboidal fossa? Your answer should be pronator teres muscle forms the medial border of the cuboidal fossa. The floor of cuboidal fossa, when we remove the neurovasculature, we observe that two muscles are present in the floor of the cuboidal fossa. The first is brachialis muscle, which is muscle present in the anterior compartment of the arm. Another muscle which is present in the floor of cuboidal fossa is supinator muscle. These two muscles are present just above the capsule of the elbow joint. So, we will repeat our boundaries. We said cuboidal fossa is a triangular depressed area just anterior to the elbow joint. Superiorly, it is formed by an imaginary line between the two epicondyles of the humerus. Laterally, it is formed by the brachioradialis. Medially, it is formed by the pronator teres muscle. The floor of the fossa consists of two muscles, supinator muscle and the brachialis muscle. The roof of the cuboidal fossa. The first layer that we dissect in a human body is the skin. Beneath the skin, there is a layer of superficial fascia. This layer of superficial fascia consists of two important structures. One are the cutaneous nerves and another is a subcutaneous vein. So, what we find in the superficial fascia are two important nerves. Look into the figure. The medial cutaneous nerve of the forearm is present in the superficial fascia overlying the cuboidal fossa. Another nerve is lateral cutaneous nerve of the forearm. This nerve is also present in the superficial fascia overlying the cuboidal fossa. The median cuboidal vein can also be seen in the superficial fascia overlying the cuboidal fossa. Now, the median cuboidal vein is actually a connecting vein which connects the cephalic vein with the basilic vein. The median cuboidal vein connects the cephalic vein with the basilic vein. The cephalic vein and the basilic vein, they are superficial veins of the upper limb. Okay, so when we discuss the roof, we said it is formed by skin, by superficial fascia containing the medial and the lateral cutaneous nerves of the forearm, the median cuboidal vein. After removing the superficial fascia, there is a layer of deep fascia, and after the deep fascia, we can find an aponeurosis which is called as bicipital aponeurosis. The relationship of these structures is also very important. In the superficial fascia, the anterior branches of the medial and the lateral cutaneous nerves of the forearm are present, and just above them, or you can say just superficial to them, the median cuboidal vein is present. So, in the superficial fascia, the vein is superficial while the nerves are in relationship to the vein, they are deep. The contents of the fossa from medial to lateral are, but before I go to the contents, we will briefly revise the boundaries. Okay, so cuboidal fossa is actually a triangular depressed area anterior to the elbow joint. Superiorly, you can see it is formed by an imaginary line present between the two epicondyles of the humerus. Medially, it is bounded by pronator teres muscle. Laterally, it is bounded by brachioradialis muscle. In the floor of the muscle, you can find two muscles, brachialis and supinator muscle. The roof of the cuboidal fossa is formed by skin, superficial fascia, and deep fascia. The superficial fascia contain two important structures, the medial and the lateral cutaneous nerves of the forearm and the median cuboidal vein. Now we are going to discuss the contents of the cuboidal fossa. Now you have to remember the contents along with their relationship, that which content is most medially present. So when you open the cuboidal fossa, you will find that median nerve is present in the most medial location of the cuboidal fossa. The most medial structure present in the cuboidal fossa is the median nerve. The median nerve crosses the arm, enters into the cuboidal fossa, and then it passes between the two heads of the pronator teres. The pronator teres muscle has two heads. The median nerve passes between the two heads of the pronator teres muscle to enter into the forearm. The next structure which is present in the cuboidal fossa is the brachial artery. The brachial artery passes from the arm, enters into the cuboidal fossa, and just at its apex, it divides into its two terminal branches, the radial artery and the ulnar artery. So from medial to lateral, the first structure is median nerve. Then you will encounter the brachial artery. Just lateral to the brachial artery, there is a tendon which is of biceps muscle. The biceps tendon and the bicipital aponeurosis are present just lateral to the brachial artery. The bicipital aponeurosis separates the brachial artery from the median cuboidal vein which is present in the superficial fascia of the cuboidal fossa. Lateral to the biceps tendon, we can find a nerve. This is the radial nerve. The radial nerve passes from the arm in the region of the cuboidal fossa and it divides into two branches. A superficial branch of the radial nerve and a deep branch of the radial nerve. You can clearly see in the figure, this is deep branch of radial nerve and this is superficial branch of the radial nerve. So we are going to revise the contents of the cuboidal fossa. We have four contents present in the cuboidal fossa. The most from medial to lateral. The most medial structure is median nerve, then brachial artery, biceps tendon and the radial nerve. The median nerve passes between the two heads of the pronator teres. The brachial artery divides into its terminal branches, ulnar artery and the radial artery. The biceps tendon is present just lateral to the brachial artery. The radial nerve divides into its two branches, the deep branch of radial nerve and the superficial branch of the radial nerve. Now we will see the surface anatomy of the cuboidal fossa. Now you can see when the arm is extended, when the elbow joint is extended, a triangular depressed area can be observed, and in this triangular depressed area very clearly a vein can be seen which is called as median cuboidal vein. This median cuboidal vein is actually connecting the basilic vein with the cephalic vein. Supratrochlear lymph nodes. One or two supratrochlear lymph nodes lie in the superficial fascia near the cuboidal fossa. They are placed just above the medial epicondyle of the humerus, medial to the basilic vein. These supratrochlear lymph nodes, their afferents drain the middle, ring and the little finger, the medial portion of the hand and the medial side of the forearm, while the efferents from the supratrochlear lymph node enter into the lateral axillary lymph nodes. So by this we have completed the cuboidal fossa. Now we will discuss the anastomosis around the elbow joint. Anastomosis is actually communication between the two arteries, connection between the two arteries. So collateral circulation is very important to allow the blood to reach the forearm when flexion of the elbow compromises the flow of blood through the terminal part of the brachial artery, or if the terminal part of the brachial artery is blocked by any cause, the collateral circulation, the anastomosis between the vessels, will help to maintain the blood flow in the forearm. Numerous arteries are participating in forming anastomosis around the elbow joint. Now you have to look to the figure. The superior ulnar collateral artery, the inferior ulnar collateral artery, both are branches of the brachial artery. They run downwards towards the elbow joint and form anastomosis with the other arteries. The other arteries are recurrent branches from radial, ulnar and interosseous arteries. Okay, so before we go to the anastomosis, we should know the vessels which are present in the arm. Now look carefully into the figure. This is the brachial artery which runs downward in the arm, and it divides into radial artery and ulnar artery. The brachial artery gives a major branch which runs in the posterior compartment, and it is called as profunda brachii artery. The brachial artery gives out collateral arteries, the superior ulnar collateral, the inferior ulnar collateral, which contribute in anastomosis. The other arteries are, you can see in the figure, the recurrent arteries. Look over here. Radial recurrent artery, ulnar recurrent artery. There are two ulnar recurrent, anterior and posterior ulnar recurrent arteries. The word recurrent means moving back, running upward. So these are the two ulnar recurrent arteries which are going up towards the elbow joint to form anastomosis with the superior and inferior ulnar collateral arteries. We said there is a recurrent interosseous artery as well. So look over here. This is the common interosseous artery, and from here and from the common interosseous artery, a recurrent artery is running in the posterior part of the forearm and reaching upward. Interosseous recurrent. Interosseous recurrent, which is running towards the elbow joint to form anastomosis. From the profunda brachii artery, the articular branches run downward, which are called as radial, collateral and middle collateral arteries. They run downward to form the anastomosis near the elbow joint. So briefly, if we say, two branches from brachial artery, superior ulnar collateral, inferior ulnar collateral, two branches from profunda brachii, the radial collateral, the middle collateral, two branches from the ulnar arteries, the anterior ulnar recurrent, the posterior ulnar recurrent, one from the interosseous artery, the interosseous recurrent, and one from the radial artery, the radial recurrent. Now all these arteries anastomose at the level of the elbow joint to form a collateral circulation. You can again see in this figure the anastomosis formed at the elbow joint, and the contributing arteries are superior ulnar collateral, inferior ulnar collateral, radial collateral, middle collateral, interosseous recurrent, radial recurrent artery, anterior and posterior ulnar recurrent arteries. All of these arteries form a collateral circulation at the elbow joint. Okay, cuboidal fossa is a very important area as it is a site of IV injections, as it is a site where we can give IV injection easily into the median cuboidal vein, or we can draw the blood from the median cuboidal vein. It is a site where the blood pressure is recorded by the brachial artery. There is a clinical condition called as cubital tunnel syndrome. Just posterior to the medial epicondyle of the humerus, the ulnar nerve is running and it is bounded in a cubital tunnel formed by a retinaculum, or you can simply say formed by a condensation of the fascia. The ulnar nerve is running just behind the medial epicondyle of humerus and is protected by a deep thickening of the deep fascia. Now in older patients, they may develop degenerative changes within this tunnel which compresses the ulnar nerve when the elbow is flexed. The repeated actions of flexion and extension of the elbow may lead to local nerve damage resulting in impaired function of the ulnar nerve, and the condition is called as cubital tunnel syndrome. So what is cubital tunnel syndrome? Simply, it is the compression of the ulnar nerve which is passing in the cubital tunnel. How the tunnel is formed? It is formed by the medial epicondyle of the humerus and by the retinaculum, or you can say by the fascia. Now in the region of the cubital fossa, a dialysis fistula can also be created. The brachial artery is anastomosed to the cephalic vein at the elbow to form a dialysis fistula. Now, dialysis is performed in the patients who are suffering from renal failure. The lecture was taken from Gray's Anatomy as well as from Keith and Moore, KLM. If you have any queries,